Have you ever felt like you're just drowning in health information online,
Oh, absolutely.
trying to figure out what's real, what's, just noise, especially when it's about something that could really affect you personally?
It's overwhelming. And often the loudest voices aren't the most accurate.
Exactly. That's why we're doing this deep dive today. We want to cut through all that static for you.
Hmm.
Our focus is testosterone replacement therapy, TRT. Specifically, we're looking at the side effects, what's real, what isn't, and importantly, how you manage them.
And we're drawing heavily from Nelson Virgil, the founder of ExcelMale.com.
Right, which is a huge resource, founded back in 2013, and now it's got, over 42,000 members?
Yeah, it's a massive online community, a really significant voice in this space.
So our goal here, our mission for you listening, is simple. Walk away with a clear, solid understanding of TRT, its actual side effects, and the ways to handle them, so you feel genuinely well-informed.
And the great thing about using Virgil's insights is that it's grounded in, the experience of thousands of men, not just theory.
Absolutely. Real-world stuff. Okay, so let's set the stage. What exactly is TRT, and who typically needs it?
Well, fundamentally, TRT is a medical therapy for men who have clinically diagnosed low testosterone.
And what does low mean in practice?
Generally in the U.S., insurance often looks for levels under 350 nanograms per deciliter, NGDL.
Okay.
But it's important to know some doctors, especially if you have symptoms, might treat levels that are a bit higher, say under 500 NGDL.
Right, because the number isn't everything if you're feeling the effects. What are those telltale signs Nelson Virgil points out? The symptoms.
He lists the common ones you might expect. Low sex drive, maybe erectile dysfunction issues. Also things like low mood, feeling constantly tired, finding it hard to concentrate or focus.
Yeah.
And even just, struggling to cope with everyday stress like you used to. It's usually a cluster of these things.
That makes sense. It's rarely just one thing in isolation. And that resource you mentioned, ExcelMale.com, it sounds like a good place to dig deeper.
Oh, definitely. Founded by Nelson Virgil in 2013, like you said, over 42,000 members. It's become this incredible hub.
What kind of people are on there?
It's really diverse. You've got doctors, pharmacists, dietitians, trainers, nurses, all contributing alongside, just regular educated men from all over the world sharing their own journeys.
Wow.
And they offer a ton of free resources, too. Nelson's book, Testosterone and Man's Guide, fact sheets on specific things like HCG, side effect management guides, newsletters. It's genuinely valuable if you want to learn more.
Okay, so that's the what. But before we get into the potential side effects, we really need to tackle some of the big fears, the myths floating around. There's a lot of anxiety out there.
There really is, and it's fascinating how media stories or, frankly, lawyer advertising can sometimes blow things out of proportion.
Yeah.
Nelson Virgil makes a strong case based on long-term data, dismissing several common worries, like liver issues.
That's a persistent one.
Yeah, but he states very clearly, TRT delivered via injections, creams, pellets, the usual methods. It does not cause liver toxicity, full stop. That's a big one to clear up.
Okay, that's huge. What about the C word? Prostate cancer. That's probably the #1 fear for many guys.
Another absolutely critical point, and again, often misrepresented. Long-term studies show TRT does not cause prostate cancer.
Okay, but there's a nuance there, isn't there?
Exactly. Here's the key distinction. If a man already has existing, maybe undiagnosed prostate cancer, TRT could potentially accelerate its growth, but it does not start the cancer. It doesn't induce it.
That's a really important difference. And the third big scare tactic, we often see heart attacks or heart disease. Those headlines can be terrifying.
They really can. And Nelson tackles this head on. He points out that the narrative is often backwards. Low testosterone itself has actually been linked to an increased risk of heart disease.
So the opposite of what the scary stories suggest.
Pretty much. A lot of those alarming media reports, often fueled by lawsuit narratives, just don't hold up against the bulk of long-term scientific evidence. It's crucial for you, the listener, to separate that fear-mongering from the actual data.
Okay, so debunking those major fears is a massive relief. But let's be real, no treatment is completely without potential effects. What's the main side effect Nelson Virgil highlights, the one men on TRT really need to watch?
The single most important one he discusses consistently is high hematocrit.
Hematocrit, can you break that down? What is it?
Sure. Think of it like this. Imagine a test tube of your blood after it's spun down. Hematocrit is basically the percentage of that total blood volume taken up by red blood cells at the bottom.
Got it. And why does taking testosterone make that go up?
Because testosterone is what's called a hemopoietic drug. fancy term, but it just means it signals your bone marrow and kidneys to make more red blood cells.
Okay.
Now, this can actually be a good thing if you have low red blood cells, like in anemia, but
That's a but.
there's a but. The risk comes if you produce too many red blood cells. It makes your blood thicker, more viscous.
Like sludge.
Well, maybe not quite sludge, but definitely thicker. And that thickness, if it's unmonitored and unmanaged, can increase the risk of cardiovascular events. That's the real link to the heart attack issue, not the T itself, but the potential for thickened blood if you're not careful.
Right, so it's a management issue. How closely do men need to track this?
Monitoring is absolutely vital, especially, Nelson stresses, in the first 6 months you're on TRT.
How do you check it?
It's a standard part of a blood test called a CBC complete blood count. And Nelson points out it's usually very inexpensive. He mentions you can even order it online, like $29 on his site. So cost isn't really a barrier.
And is there a specific number, a danger zone to avoid?
Yes, the critical level to stay below is around 53–54%. Nelson gets really concerned when he hears about guys letting it drift up to 60%, even 70% without monitoring. He calls that like basically taking a bomb.
Wow, okay. Strong words. So if your hematocrit starts creeping up towards, say, 52–53%, what do you do? What are the strategies?
The number one strategy is simple. Donate blood.
Just regular blood donation.
Yep. It directly removes those excess red blood cells. And think about it, it's a fantastic win-win. You manage your health and you're helping save lives.
That's a great way to look at it. What if someone can't donate, though? Like if they don't meet the Red Cross criteria for some reason?
Good question. In that case, your doctor can write a prescription for what's called a therapeutic phlebotomy.
Right.
It's basically the exact same procedure. They draw the same amount of blood at a blood center, but because it doesn't meet donation standards, the blood is just discarded. But it achieves the same goal for your hematocrit.
Makes sense. Is it better to donate before you hit that 53–54% ceiling?
Definitely. Nelson advises being proactive. Don't wait until you're right at the limit or over it, because the blood center might actually turn you away then. He suggests donating when you're maybe in the 49–52% range. Just stay ahead of the curve.
Does everyone need to donate regularly forever?
Not necessarily. He mentions that for some men, hematocrit levels kind of stabilize after maybe 18 months or so on TRT. Nelson himself, anecdotally, says he's only needed to donate once in 24 years.
Oh.
But others, maybe due to genetics, might find they need to donate pretty regularly, maybe every 3 or 4 months, to keep it in check. It varies.
Okay, but what about going too often? Is there a risk in donating, say, every month?
Yes, absolutely. And this is a really crucial warning. Donating more often than about every 3 months can cause its own problems.
Like what?
Studies show it can crash your iron and ferritin levels, and low ferritin causes fatigue, tiredness. Basically, it can make you feel lousy and counteract the benefits of the TRT itself.
So you could end up feeling tired again, but for a different reason.
Exactly. If that happens, you might need iron supplements, but the real key is finding that right donation frequency for you and not overdoing it.
Okay, hematocrit is clearly the big one to manage. What else might come up, even if less common?
Well, some men, though it's rarer, might experience a bit of high blood pressure or edema, that's water retention.
Who's more likely to see that?
It tends to affect men who already have some underlying issues like metabolic syndrome or existing cardiovascular risk factors.
And management.
It usually involves things like diuretics if needed, really focusing on weight management, getting more cardio exercise in, and being super careful with diet, especially sugar and alcohol, which can worsen water retention.
Got it. And then there's the sensitive topic, testicular shrinkage and fertility. How does TRT impact that, and what can be done?
Right. So TRT can signal your brain to reduce its own production of certain hormones, luteinizing hormone, LH, and follicle-stimulating hormone, FSH.
And those are important for?
They're key signals that keep the testicles, specifically the Leydig cells, healthy and producing sperm. So TRT can lead to testicular atrophy or shrinkage and reduced fertility because those signals get turned down.
But is that reversible or preventable?
Yes, very much so. The main tool here is a medication called human chorionic gonadotropin, or HCG.
HCG.
Yeah. HCG basically mimics the action of LH, so it can help maintain testicular size and function and even reverse atrophy that's occurred.
Infertility?
Critically, yes. When used alongside TRT, HCG can often help men maintain or even achieve fertility if they're looking to have children. Nelson has a lot more detailed info, like specific protocols for HCG in other videos and resources on ExcelMale.com. If you step back and look at all this, what Nelson Virgil is really highlighting is just how crucial it is for you, the patient, to be informed and engaged in your own treatment.
Yeah.
Knowing about these potential issues and knowing there are proven ways to manage them, it really shifts the whole perspective on TRT. It makes it a much safer, much more effective therapy for the guys who genuinely need it.
That really is the core message, isn't it? It's about moving past the fear, which is often based on myths,
Yeah.
and getting into a place of understanding. Knowing these things are generally manageable, that there are clear steps you can take. It just demystifies the whole process, which is
Yeah.
incredibly empowering if TRT is something you're considering or already using. So we've covered a lot today. We've tried to bust some of those big myths of the unfounded fears about liver damage, prostate cancer, heart attacks. And then we really dove into the real side effects, focusing hard on high hematocrit because it's so key, but also touching on blood pressure, water retention, and the testicular effects, along with how to manage them effectively.
And resources like ExcelMale.com with Nelson Virgil's guidance are clearly invaluable for getting that practical, detailed information.
Absolutely. It underscores that while TRT can be incredibly beneficial, you absolutely need that informed monitoring and proactive management for it to be safe and successful long term.
Couldn't agree more.
So thinking about all this emphasis on monitoring, on management, it leaves us with a final thought for you to consider. In this world just flooded with health information, often conflicting, sometimes scary, how vital is it to not just seek out knowledge, but to make sure that knowledge is actionable, especially when it's about your own health and well-being?
That's a powerful question.
Maybe take a moment to think about what specific, actionable steps you could take with what you've heard today. Perhaps it's having a more informed conversation with your doctor, or maybe it's digging into some of those resources we mentioned. Food for thought.